has this crisis been for people with addictions?
I think this crisis has been difficult for so many people. Some people have had access difficulties with their treatments, but then there have been some opportunities. For example, people who are accessing methadone and buprenorphine, some have been able to get that in larger doses because we're trying to avoid people having lots of contact with pharmacies, for example.
Is this increase in drug and alcohol consumption addicts becoming even more addicted or more people becoming addicted?
Well, what we're seeing is increases and decreases. So in our global drug survey, in our interim findings, we've seen substances like alcohol and cannabis. People are mainly increasing in the use of those substances, where the opposite trends are true for MDMA and cocaine, where the majority of people say they're decreasing in their use. So a lot of this relates to the different reasons why people use these drugs.
Who's especially at risk, would you say?
When we had a look at our data, we saw that people who were reporting serious mental health problems were much more likely to say that they had increased their use of alcohol or drugs. And so obviously for those people that are having trouble coping with the unusual situation we find ourselves in, they can be especially at risk.
So this is not just a problem for addicts, it's also a mental health problem. Is that what you're saying?
Yeah, it's certainly from our data looks much more across the population. So it really it reaches a small proportion of people that actually have problems. But what you find, of course, is that alcohol, cannabis and other drugs are used by a large number of people that don't find themselves in an addictive state, that aren't seeking treatment, but they too are increasing their use. And that sort of thing can sneak up on people. So we have to really watch out for, I guess, population level changes in drug and alcohol use.
So what's the best treatment when addiction centres are already full due to social distancing, or treatment budgets are being slashed in the US, or you're basically told to go cold turkey in South Africa?
That's a real concern because, like, as an example, where I am in Australia, alcohol bottle shops were actually designated an official. They were designated a service that couldn't close. So unlike in South Africa, they weren't banned. And that was because it was understood that people that drink daily, if they were to suddenly stop drinking, would be in much more problems in withdrawal than continuing to drink. So it is a real problem to just take away the supply. That's not actually going to solve the issue.
How do you prevent the risk of addiction in the first place then?
Well, that's a $1 million question there. I don't think anyone really has the answer to how to prevent addiction in the first place. But what's really important is to, I guess, the antidote to addiction is to connect, to be able to have solid connections with people, with our friends, with our partners. And of course, that's the issue with the COVID-19 lockdowns, is that for many of us, we haven't been able to connect with our friends. We haven't been able to feel that sense of belonging. And so that in itself can actually cause people to turn to drinking and to taking drugs more than they did before.
Well, I know it's all because of the outbreak, but it's governments that have disconnected us. How can governments reconnect us then?
Well, I think it's interesting that in some countries it's called physical distancing, not social distancing, because we have technologies that can help keep us connected. They don't necessarily, work as well as just a proper hug or a proper kiss. And I think, proper talking side by side, it's really hard to replace that sense of connectedness. So I guess what governments might want to do is to obviously help get us through this crisis as quickly as we can, so we can get to the other side of isolation and start to reconnect on a physical level. Now, hopefully there's a vaccine that would obviously help, but this is something that globally we're in for the long haul, and we have to try and get through and stay connected with each other in the meantime.
Hope a lot of people are listening and connecting with our talk today. Dr. Barrett, RMIT Australia, thank you very much.